Hi, this is Dr. Gerald Boyer from Midwest Rejuvenation. I wanted to talk to you a bit about andropause. This recorded version of our presentation is brief and designed for online use for those wanting a brief explanation of andropause and what it means for their general health. A little bit about Midwest Rejuvenation. We specialize in age management. Age management is the field of medicine that focuses on disease prevention and wellness, particularly to manage the aging process and prevent many of the symptoms and chronic diseases associated with aging. A large component of this is hormone replacement and optimization, and that's why I'd like to talk to you a little bit about andropause today. So andropause was described in 1944 by a couple of scientists who described what they called the climacteric man. And this term was coined to describe the decline in male hormones, primarily testosterone, and the symptoms that accompany that. Many symptoms accompany the decline in testosterone. Some of them are physical, namely decreased muscle mass, decreased strength and energy, increasing fat, decreased libido and sexual drive. Some of these symptoms are emotional, depression, anxiety, becoming sad and grumpy. Basically, it's the male version of menopause. We're all familiar with menopause, the changes that a woman goes through with the rapid decline in estrogen production in her later years. So let me take a minute to compare and contrast menopause and andropause. What are the causes? Well, menopause, as we already described, arises from a declining estrogen levels. Andropause from declining testosterone levels. The onset of menopause typically varies, but typically in the 50s or 60s. The exception to this would be patients with premature onset of menopause. This can come from a variety of reasons. This can be hereditary. This could be medication-induced. And probably the more common, particularly years ago, would be hysterectomy with removal of the ovaries, so-called surgical menopause. In men, unfortunately, this andropause typically begins at 30. I'll explain the reason for that later. Menopause is widely recognized by the medical community and by the non-medical community at large. Andropause, however, is not widely recognized and actually was described hundreds of years after the description of menopause. Menopause can be associated with life-threatening disease. As estrogen declines in a woman's later years, she becomes more prone to heart disease and reaches the risks that we see in the male population. Also, her risk of osteoporosis dramatically climbs, with the threat of pathologic vertebral fractures or pathologic hip fractures. Andropause also is associated with life-threatening diseases. However, very often these are worse. We still are associated with the same risks as menopause, but also some other ones, and we'll discuss this later. Are these treated? In the case of menopause, this is often treated. In the case of andropause, it is almost never treated. Part of this is because men are reluctant to admit that anything is wrong or that anything's getting worse. It's also not widely addressed by the medical community. And when it is, unless that physician has special training in hormone replacement or age management medicine, typically it is undertreated or treated improperly. Let's talk a little bit about the male hormones that contribute to andropause. This namely is testosterone. Testosterone is the most abundant male hormone in young, healthy males. This declines after the age of 30. Our peak levels, however, very often are in the late teens and early 20s. The testosterone levels decline rapidly after the age of 50 in many males. Testosterone is actually produced in the testicles by what are called the Leydig cells. However, the amount of testosterone production is actually controlled by the pituitary gland. The pituitary gland is a gland that sits at the base of the brain and secretes several hormones that regulate the growth of Leydig cells and ultimately their production of testosterone. It is regulated by what's called a feedback loop, meaning as your testosterone levels go up, this stimulates the pituitary gland to decrease the stimulus to the testicles to produce more testosterone. Here's the chemical structure of testosterone. Testosterone is a steroid. Now, steroid is just the type of chemical structure. There are a lot of steroids. Don't necessarily associate that as a bad term, such as anabolic steroids. We're really just referring to the chemical structure here. Testosterone, like most steroids, are produced from cholesterol molecules, again, in the Leydig cells primarily. The chemical process by which this occurs is pretty long and boring, and I won't bore you with that now. So the function of testosterone, one function is it's what's called androgenic. And what androgenic means is that it promotes the male phenotypic features. And what does that mean? It creates the features that make us male. For instance, development of the male sexual organs, the growth of facial hair, masculine build, deep voice. It's also anabolic. Anabolic means it promotes the growth of tissues. And the way it promotes this is it binds to what are called androgen receptors. These are the parts of a tissue or cell on the cell surface that the hormone actually bonds to. And some of the typical examples are muscle and bone, although androgen receptors are present on many tissues throughout the human body. So what are the symptoms of low testosterone, otherwise known as andropause? I've listed a few of them here. Decreased libido, loss of morning erections, decreased lean muscle mass, increasing obesity, lethargy, mood changes, decreased performance at work. You may recognize some of these in yourself. You know, we've come to accept increasing obesity just as part of growing older, but have you ever stopped to think that this may be secondary to decreased testosterone levels? Many of us know that as we continue to exercise and diet as we get older, we just can't lose the weight like we used to or maintain a healthy body weight. And really trying to do this with inadequate testosterone levels is trying to operate, you know, an 8-cylinder vehicle on only 4 cylinders. You're just not going to be as effective. A lot of these other symptoms, very often we're going to treat with other means, very often less effective. For instance, decreased libido and erectile dysfunction very often is treated with Viagra or Cialis, those type of medicines. Mood changes and lethargy very often get treated with antidepressants. Obesity, weight loss pills, or sometimes it's not treated at all. However, the symptoms are only half of the story. The other part has to do with the dangers of low testosterone. Is it dangerous? Absolutely. And again, it depends on how you view aging. If your goal is to sit back and accept the changes that we commonly accept with aging and the health problems we commonly accept with aging, then perhaps you don't consider it dangerous. But let me point a few things out to you. Low testosterone is associated with a number of life-threatening problems. For instance, increased risk of osteoporosis. This is both in men and women. Women have testosterone as well, and as a matter of fact, testosterone is the first hormone to decrease in females. So testosterone decreases and the risk of osteoporosis goes up. I had mentioned earlier that this makes you prone to pathologic fractures of the vertebrae or the hip. And you may be surprised to know that when men fracture a hip from osteoporosis, they're twice as likely to die from that as a female is. Low testosterone is also associated with an increased risk of cardiac disease, an increased risk of obesity, which leads to diabetes. It's also associated with cognitive decline, decreased muscle mass, and probably the most important statistic is that it is increased risk of all-cause mortality in males. That means your risk of dying from anything, or better phrased, your risk of dying from any cause at all is increased by low testosterone. So what can you do about it? Well, you can replace your testosterone. And if you're having this managed by your family doctor, typically what you're going to see is if that you're in the absolute bottom of the barrel, meaning you are super low, you will have your testosterone replaced. And the problem that we see is typically the dosage form or the dosage frequency is suboptimal, meaning it'll get your testosterone to barely adequate levels at times, but at other times it'll typically trough out and be too low. But, in the case of testosterone, we really should manage this like any other important health concern. For instance, when we treat somebody for high cholesterol, which we know is associated with heart disease, we don't simply shoot to kind of lower it, we shoot to make it optimal. Meaning we want to get testosterone, or excuse me, we want to get the cholesterol in the range that's associated with the lowest incidence and the lowest risk of heart disease, peripheral vascular disease, and stroke. Well, the same holds true for testosterone. We don't want to just get you into a normal range. We'd like to get you into the optimal range. And placing you in the optimal range, studies would suggest will lower your risk of death from all-cause mortality. It will lower your risk of cardiac disease. It will help you lose weight. It will help you boost muscle mass. It can help with libido. It can help with any number of things depending on what your symptoms are. How do we get these optimal results? Well, careful monitoring of hormone levels. So this is done with some pre-treatment blood work. And based on a patient's individual goals and other health needs, we select the optimal route of administration and optimal dosing. What are the routes of administration? Really the gold standard, or what other treatments are compared to, is typically intramuscular injections of testosterone. We usually have our clients do them themselves, as they're quite easy to learn and administer. But it can also be dosed in other forms. There are patches, there are transdermal creams, there are injectable pellets. Each one has its own particular advantages and disadvantages. But then also monitoring those levels post-treatment and periodically through the treatment to be sure that the testosterone levels are not just in the normal range, but are in the optimal range. Furthermore, we need to test for certain breakdown products of testosterone to be sure that you don't get any side effects from testosterone replacement. The one thing I want to point out, one of the things that patients routinely will ask that they're concerned about is if testosterone replacement will promote the risk of prostate cancer. And the answer is no. Studies do not suggest an increased risk of prostate cancer in patients started on testosterone replacement therapy. There has been a study that shows if you already have prostate cancer and you are treated with castration, which means removal of the testicles or removal of all sources of testosterone, if you then give back the testosterone at some point, it can cause the prostate cancer to grow. And this certainly makes sense. And this is also the reason why the presence of prostate cancer we consider to be a contraindication for testosterone replacement therapy. And contraindication means that it's not advised. There may be some bad deleterious side effects that come from testosterone replacement in those individuals. The other thing we worry about is prostate hypertrophy, meaning an enlarged prostate. One way that we safeguard against that is, again, we follow some of the breakdown products of testosterone, and to be sure that these don't get into the range that are going to be a problem for the prostate. So what can you do? If you're concerned about andropause, what are the next steps? You may have noticed many of the symptoms of andropause that we mentioned on our previous slides. And if you have any of those, it's simple to investigate andropause. First, there's a free screening test available at our website, which is midwestrejuvenation.com. If you go to the low testosterone portion of the webpage and take what's called the ATOM questionnaire, it will screen you for testosterone deficiency. If you do test positive for testosterone deficiency, you should definitely get your testosterone levels checked. The best way to do this is with blood work, and we can arrange this for you. But even if your screening test suggests that you are not andropause positive, but you have symptoms of such, you should probably definitely be tested as well. You can order your labs through our website. The other thing you can do is take advantage of our free virtual consult. If you visit our website, midwestrejuvenation.com, you'll find a link for a free consultation. The way this works is you fill out a brief medical history, tell us how you would like to obtain your labs, and we will send you a requisition for a lab test. Some patients already have their labs and they're just looking for a second opinion. We do provide you a mechanism to upload your labs to our servers. Once we have some lab data that we can review and your medical history forms that we can review, we invite you to take advantage of our free virtual consult. We do this with web conferencing software and review your labs, your medical history, and your symptoms. And at the end of this, offer our recommendations for testosterone replacement. This is something that we can manage for you if you wish, as long as you have your other medical care taken care of elsewhere, as we do specialize in anti-aging medicine and testosterone replacement, as well as bioidentical hormone replacement for women. There's no obligation. The information is yours to do with as you wish. But again, we do feel obligated to advise you of the best treatment option for testosterone replacement. This concludes our seminar for today. If you'd like more information about anti-aging medicine, Midwest Rejuvenation, or testosterone replacement, you can visit our website at midwestrejuvenation.com, or you can view our other videos on various topics around male health, bioidentical hormone replacement, and anti-aging medicine. Thank you.